Hello, and thank you for tuning into our discussion about human rights, specifically in reference to Article 25 of the Universal Declaration of Human Rights. Article 25, in brief, is essentially the right of people to housing, medical care, and assistance for things that would affect a person's livelihood. So, with that being said, we're going to start our discussion with welfare programs. What is welfare?
Kenzie and I did two different definitions of welfare, one being a Merriam-Webster definition, and that would be the state of doing well, especially in respect to good fortune, happiness, well-being, or prosperity. The second definition that we found was the government's definition, which was it's a government program which provides financial aid to individuals or groups who cannot support themselves. Welfare programs are funded by taxpayers and allow people to cope with financial stress during rough periods of their lives. In most cases, people who use welfare will receive a bi-weekly or monthly payment. The goals of welfare vary, as it looks to promote the pursuance of work, education, or in some instances, a better standard of living.
What ways is welfare benefiting people, and in what ways is making things harder on people?
Welfare benefits people with food assistance programs, school programs for children, health care benefits, housing assistance, and financial assistance. With the food assistance programs, there are two different types. There's food stamps and WIC. School programs for children that come from low-income families where they get free or reduced breakfast and lunches all throughout the year of school. I'll be talking about what exactly WIC is. WIC, the description of WIC, it's for women, infants, and children, and it provides supplemental foods, nutrition education, and referrals to health care at no cost to low-income pregnant, breastfeeding, and postpartum women. And for the guidelines, children are up to the age of 5 who are determined to be at nutritional risk. And with the WIC program, it's supposed to decrease hunger, and it also goes by state. So you can only buy Pennsylvania-grown food with the WIC checks. It also goes back to Article 25, because in Article 25, it says motherhood and childhood are entitled to special care and assistance. All children, whether born in or out of wedlock, shall enjoy the same social protection. And that's what is being done when using WIC checks. With health care benefits, there is Medicaid and CHIP. CHIP is for children that come from low-income families under the age of 19. Medicaid is a program that covers millions of Americans, and a statistic shows from July 2018, there are 66.7 million people covered by Medicaid. Medicaid provides health coverage to millions of Americans, including eligibility from low-income adults, children, pregnant women, elderly adults, and people with disabilities. And now with Kaylee talking about the cons.
Okay, so cons for welfare. Even though welfare is needed to sustain the standard of living of all human beings, it can also hinder other individuals who are providing. Welfare is really good and beneficial when not many are on it, but when too many people are on it, it becomes harder for those who are working because their taxes go up. Another thing is that welfare is also making it hard on people who are on welfare, because by allowing them to we're going to restart a little bit. Welfare is hard on people by allowing them to become dependent on a system. Welfare has its benefits for those who need it, but it should not be a system that supports healthy beings for an extended amount of time without showing them how to become an important part of our country, which is the workforce. So there are cons for people on welfare, and there are also cons for people who are providing for the welfare system.
What should be done about the poverty line in order to satisfy everyone?
If a single person makes less than $12,140 a year, they are considered to be under the poverty line. Average rent costs in Pennsylvania are $895 a month, which add up to $10,740 a year. Of course, someone can find an apartment that is cheaper than this, but even still, there are many other costs that can still add up. For example, the average person spends $125 on groceries per person per month. Healthcare is an average of $321 per person per month.
So when you take account to all these numbers, the marriage rate has plummeted, which means that there's mostly children who have one parent. 1 million kids in America right now are being raised by their grandparents because fathers reject their responsibility, which increases the risk of children living in poverty. And right now, poverty is at 18% for children and 14% for seniors, and that adds up to 46.7 million Americans nationwide. So right now, a family of 4 receives $900 monthly, and a single person home receives $300 monthly in welfare income. The amount of money they receive does not support the amount of rent and groceries, clothing, and all these other items that they have to pay for themselves out of pocket. And even if they do have a job, they still don't receive enough income to support themselves.
Now to shift gears a little bit, Article 25 also addresses how medical care / medical treatment should be a human right that is guaranteed to all. So another discussion we'll be having is about the healthcare system and what we can be doing to ensure Article 25 is in action. So for our first question, it's kind of a combined question. Is there a popular model of healthcare that countries follow? And why do they follow that model? Why shouldn't they follow that model?
In my research, I found that there is not one specific model that countries all follow. I found that there's 4 different models that different countries follow. So there's the first one, which is the beverage model. This is your stereotypical United Kingdom type healthcare. The countries doing this would be Great Britain, Spain, most of Scandinavia and New Zealand, and Hong Kong because that was once a English territory. And then there's the Bismarck model, which was named for the Prussian Chancellor Otto von Bismarck. And this one includes Germany, of course, France, Belgium, Netherlands, Japan, Switzerland, and to a degree Latin America. Then there's the National Health Insurance model, and this one is Canada's health system. And then there's some newly industrialized countries that can follow under it, which would be Taiwan and South Korea. And then there's the last one, which is the out-of-pocket model. This one, from my research, didn't really have any specific countries that fell under it, but they did talk about the United States, and it said that, quote, "The United States is unlike every other country because it maintains so many separate systems for separate classes of people. All the other countries have settled on one model for everybody." And then it's much simpler than the US system, and it's fairer and cheaper too. So back to the question, there's 4 popular models, there's not just one. And the second question was, why do they follow the model? They follow it because of their history, they follow it because of their government, because maybe one style of healthcare, just because it might work in one country, doesn't exactly mean that it would fit in another country, because there are very different government styles around the world. There's very different histories around the world. And just because one thing works in one place doesn't mean it works in every other place. And so yes, America, we do have a complicated system in terms of healthcare. It's not the greatest, but I wouldn't say that all the other ones are great either. But at the end of the day, it's what works best for whatever country you're in.
So right now in America, the average amount a person pays for healthcare is $321 per month, which is $3,852 per year. So the penalty for no healthcare, if you decide not to pay healthcare or not to get it, it's $695 for one adult and $347 per child, or 2% of the household income, which when you look at it that way, it's taking away more money than they're actually receiving. So if these people are getting basically penalized for not being able to get health care, how are they really paying for other things that they actually need, like their rent or groceries? And obviously they need health care as well, but if they're not receiving a certain amount of money or like funds, or they can't pay for it because just what they get from their jobs, just what they get paid for as a salary isn't sufficient, how are they really supposed to get better healthcare. So what I'm trying to say is, even though free healthcare wouldn't work in second and third world countries, it could work here because there are so many people that need healthcare, and there are so many different programs that could be started or used to help people who are on welfare, for example. And if they get rid of this burden of paying for healthcare or getting penalized for not having healthcare, that's one less thing they need to worry about, and one more thing that this country has to help these people.
So for our second question, how would free healthcare affect second and third world countries? If it has a negative effect, what would be a better way to get people to get the care that they need?
Kenzie and I do not believe that free healthcare would work in these second and third world countries. Kenzie's going to go into a little bit after I do, but I got some statistics on some third world countries like Congo. Congo's a third world country, and their unemployment rate is at 46.1%, which is over a quarter of their population without work. Where I'm going with this is that in second and third world countries, they're developing countries, and normally not many people are in work, or their state of living isn't that great. So I decided to look up statistics on unemployment rates to see how many people are without work and if that would affect free healthcare, because free healthcare really depends on the taxpayers' dollars. So if you're not having that many people with work, you don't really have a lot of taxpayer dollars to go to the free healthcare. So places like Congo, they have a very high percentage of unemployment rate. So there's over a quarter of their population that is without work. Haiti is another third world country with an unemployment rate of 14%. And there is a little bit of difference. Like, there are third world countries like that which have high unemployment rates, which free healthcare wouldn't work. There are some places like Cuba which don't fit the trend. Cuba's unemployment rate is at 1.7%. That's less than America's unemployment rate, which is 3.9%. Cuba also has a totalitarian communist state. They're kind of socialist because it's under government control, but it's government-led. And the thing here, though, is that Cuba has a great workforce. A lot of people are working. It looks great, which is weird. But the thing is that they're the best, well-trained type workers who work for a very low price. They're definitely underpaid for what they work for. So that's one country that's a third world country that doesn't fit the trend, but they do have national health care because the government takes their money from the work and they provide health care for the people. And yes, that does aid to quality of life, but you're kind of sacrificing a lot of other aspects of quality of life for the healthcare part. So yeah, there are other places in the world like England where you have free healthcare, or national healthcare. Same with Canada. But the thing that you'll find there is that they have long wait times for healthcare. There's still private sectors for healthcare because it's poor quality. So although you're getting healthcare to everyone, it can be poor quality and long wait times. That may work for some countries, but it may not work for others. And for the fact of like second and third world countries, Kenzie and I just don't think that it would work for them, just because of certain third world countries' demographics. But yeah, so Kenzie's going to go into her little spiel.
I said for this question, I said in second and third world countries, there's actually a shortage of doctors because there's less education going on in those countries, and it has created a shortage in doctors but a high demand of medical help. But if organizations and aids went to the second and third world countries, it would allow them to get more of an education from Doctors Without Borders, so Doctors Without Borders could help educate different women or men to become doctors and nurses, but also educating young women on safe sex and different contraception plans could potentially give a lower rate of young moms and allow them to go to school and get the money that they need. It will allow them to have a lower population also in these countries because there will be smaller families and they will also be more stable than a family with more children.
And our third and final question in terms of healthcare is where can we find a balance between medical expenses on the hospital's end, such as paying for medicine and treatment, and not changing patients when they come back and search for treatment?
I found that Big Pharma is a big problem in America. They're basically monopolizing the revenue that they're getting from their drugs that they're putting on the market. So there's brand name drug manufacturers and there's off-brand drug manufacturers. And there's an agreement between them called pay for delay. So basically, the brand name manufacturers will pay the off-brand manufacturers a good amount of money to keep their product off the market, so there's no competition. So then the only drug out there would be the brand name, therefore making it more expensive for not only the hospitals but the patients. Now, basic supply and demand. There's a big demand for medicines like insulin and epinephrine and stuff, and really there's only one product out there that people can buy, and it's so expensive, and that's because there's no competition. If there were competition between brand name and off-brand name, it would lower the costs significantly. And honestly, this is probably a really good way to lower those costs for the hospitals and the patients.
The major costs that come with healthcare mainly start with the expense of medical school and the time that goes into it. Doctors end up spending thousands of dollars on student loans and 8 years typically of their lives trying to get a medical degree. When they go into the workforce, they have to pay back these student loans as well as keep up with other expenses that they have. The hospital also has to pay for supplies and medications to support the patients, making the cost of healthcare extremely high.
So basically, if there was some way that we could lower the cost of medical school, that way these doctors wouldn't have to be charged so much for their student loans.
If you would like to learn more about Article 25, you can go to the websites that are listed on the screen. Thanks so much for listening, and we hope you enjoy International Human Rights Awareness Day.